Title: Assessment of Autism Spectrum Disorder with Children Who Are Deaf, Hard of Hearing, Part 2. Deborah Mood, Ph.D., Colorado School for the Deaf and the Blind. Split screen: the sign language interpreter and our presenter, Deborah Mood, licensed psychologist, who is sitting in front of a solid background. Captions are below on screen.
The next area that I want to talk about is difficulties with social emotional reciprocity. And what I mean by that is the back and forth nature of communication interactions and play interactions with other individuals. So in children who have an autism spectrum disorder who are hearing, what this might look like is difficulty approaching other children, difficulty having back and forth conversations. We often talk about children who have autism who have difficulty with the social chit-chat. Like, they don't understand the intention of communicating for an entirely social purpose rather than just trying to gather facts. Sometimes you'll see difficulty in play, reciprocal play. So being able to take turns in play, being flexible about shifting who's changing the play and who's making the rules in play. Those are all ways that we can see difficulties with social emotional reciprocity. For typically developing children who are deaf and hard of hearing, we usually see those early social communicated behaviors that indicate reciprocity come in line as we would expect. So that social smile that you see with your infant, when you smile at them, we would expect a typically developing deaf and hard of hearing child to smile back at you. Typically, developing children who are deaf and hard of hearing also use things like eye contact and holding things up to show or giving things to other people before they have formal language to be able to try to engage other people in a back and forth interaction. We usually see those children being able to imitate what other people are doing, which is an early skill that's necessary for building those back and forth interactions. So imitating, for infants, those facial expressions and silly mouth movements that you make with your baby, like blah, blah, blah. That one's particularly complex, but the idea is that they're trying to imitate. We also expect children who are typically developing, who are deaf and hard of hearing, to be able to engage in something we call joint attention, which is the ability to join with somebody else in sharing interest in a particular activity or toy. We know that joint attention itself can look and be established in different ways with children who are deaf and hard of hearing. So whereas with hearing children, what joint attention looks like is that idea of pointing to the object and looking back to the person that you're trying to communicate. That can be established for deaf children of deaf adults in slightly different ways. They might sign between themselves and their parents and the object, reflecting and understanding that if I sign here, then my parent is understanding that I'm talking about the object that's in the same visual signing space. The ways that deaf parents of deaf children versus others might engage their child in joint attention might be different because we have to navigate how you direct communication and object play to mediate being able to have that shared interaction. But regardless, typically we see that joint attention is the purpose of joint attention is there, that they're able to establish that shared referencing and shared enjoyment with an object or an activity. For children who are deaf and hard of hearing who have autism, joint attention is difficult. They have, again, we talked about the examples of they might point to something and not look back at the person that they're referencing, or they might have difficulty shifting their eye contact between the objects and the people that they're trying to interact with. Children who are deaf and hard of hearing are generally very interested in interacting with others in their social environment, but autism can sometimes interfere with that. And so they sometimes tend to look like they're more focused and more interested in the objects that are around than the people. And that's a key distinction for distinguishing autism for children who are deaf and hard of hearing versus typical development. some of the ways that these difficulties with reciprocity might appear later on in development might be difficulty having social conversations, engaging back and forth. So oftentimes for children who have autism, we might see them engaging in a monologue. That's a one-sided discussion where they're communicating a lot, they're saying a lot, often about a very specific interest, but they're not leaving much room for people to join that conversation or have back and forth interactions. One of the things that we have to consider in making a differential diagnosis of autism among children who are deaf and hard of hearing is what the language environment looks like. Do they have good access to others who are able to communicate with them in their chosen communication modality? Because we don't want to make an assumption that because a child who's deaf who uses sign language is having difficulty engaging with hearing peers who don't use sign language, that might reflect a mismatch between the child's communication and the environment rather than a symptom of an autism spectrum disorder. So we want to make sure that we're considering whether the communication environment is accessible for the child who's deaf and hard of hearing. One of the next criteria has to do with difficulties developing and maintaining appropriate relationships. And again, I want to emphasize that this is relationships that are appropriate to the child's developmental age. So you might have a 9-year-old who developmentally is more like a 2-year-old. And so our expectations of what their social relationships would look like would be based on an understanding of how we expect that to look for a 2-year-old rather than a 9-year-old, roughly speaking. So for children with autism, this can look like difficulty building relationships appropriate for their developmental level, whether that's being able to engage in parallel play at 2 versus being able to have truly back and forth interaction with peers using objects that they're sharing and developing elaborate play schemes together when they're older. It can reflect difficulty adjusting their behavior to the social context. So children who have difficulty recognizing that their role is not to correct all the peers in class who are not following the rules. Sometimes this is something that we see in children with autism. Sometimes it has to do with children, because autism is a continuum. You might have children who show very limited social interest and who are socially withdrawing in situations where there are peers around and communication is accessible, versus all the way up to children who are they seem socially motivated and they have some social interest, but they just don't know how to make it work. They don't know how to join other peers' play. They don't know how to establish friendships that are really reciprocal with their peers, even when the communication access is not an issue. So in typically developing children who are deaf and hard of hearing, when they're provided with environments where communication is accessible and their play follows a somewhat typical developmental course, commensurate with their developmental abilities and their language abilities. We expect children who are deaf and hard of hearing, when they have the established communication, to be able to be flexible in their play. Sometimes you see, as children who are deaf and hard of hearing are acquiring language, you might see some rigidity in their play interactions or difficulty following conversations if there's a mismatch between their language ability and their peers' ability. But again, generally speaking, if we make the communication environment accessible to them through sign or through other interventions to make it accessible to children who use an auditory oral approach, we expect them to be able to show reciprocity in their play interactions. For children who are deaf and hard of hearing who have autism, in addition to the things that we've already talked about, you might see less of that early social enjoyment, that showing and giving behavior. You often see a gap between their developmental abilities and their play skills. So children who are deaf and hard of hearing who have autism might show delays in the acquisition of pretend play skills. They're not consistent with their communication skills and their cognitive abilities. They often have difficulty making and sustaining friendships even when communication is accessible. Sometimes there are situations where, especially in early childhood, where parents or adults are doing a lot to mediate peer interactions. And so sometimes these difficulties are not really readily apparent to other individuals until we see that child struggling to make friends independent of other people mediating their interactions. Another thing to look for are social behaviors that are unusual, that might be more consistent with autism than hearing loss. So an example would be children who back into their parents' laps rather than establishing eye contact to make that affectionate gesture or to seek comfort from their parents. Children who use unusual or negative social overtures too excessively and frequently across several different contexts. So grunting at peers rather than trying to communicate first, or hitting with peers to try to initiate play rather than seeing how other peers are initiating play and following suit. Another unusual social overture that you might sometimes see is something called hand as tool use. And this is specifically the behavior of using another adult's hands to manipulate an object. So taking their hand and putting it over their parent's hand to get the parent to open a door or to activate a toy. This is a behavior that is not commonly seen either among typically developing hearing children or children who are deaf and hard of hearing. If you do see it, it's usually the communicated behavior of last resort. So they've tried everything else to get their parents' attention first, and when they're unsuccessful with that, they just get frustrated and try to get their parent to do it. But otherwise, you really wouldn't expect to see that kind of behavior. The next cluster of symptoms that we talk about in the DSM-5 are repetitive behaviors or restricted interests. So this can vary, and the DSM-5 changed this criteria a little bit to include what we call stereotyped language or repetitive speech. So that can range from those earlier symptoms that we talked about, the echolalia, or the repeating signs or phrases that they've seen somewhere else in a way that doesn't quite fit the context. It can also be children who have verbal rituals, or in the case of sign rituals, where they want somebody to say something always exactly the very same way. This can also include repetitive motor movements and repetitive use of objects. So the repetitive motor movements that I'm referring to might be repetitive movements with their hands or stereotype movements with their hands or bodies. It could be rocking, pacing, spinning excessively. There are lots of other hand and body movements that might fall into this cluster. Having said that, repetitive motor movements can be present in a variety of developmental disabilities in the absence of an autism spectrum disorder. So one thing that's important to emphasize is that even if a child has a repetitive motor mannerism, that in and of itself doesn't necessarily mean that they have an autism spectrum disorder. It's only when those behaviors are present with the additional criteria that we've already talked about. Another way that repetitive, you might see this repetitive nature of behavior might be repetitive use of objects. So repetitively playing with toys in a way that seems non-functional, lining up toys. It could be repetitively spinning something and being very focused on the spinning or the part of the object rather than playing with the object as it's intended to be used. Another area that you might see is difficulties with transitions. So difficulty transitioning from one activity to another, from a preferred activity to a non-preferred activity. So in typically developing children who are deaf and hard of hearing, we don't typically expect to see this repetitive language that we've talked about already, especially once their communication system is well established. Again, echolalia can be part of a typical developmental pattern, but it should be for a brief time and should dissipate by the time that the child has flexible use of phrase language, combining 2 or more words or signs. The repetitive motor movements are not typically associated with children who are deaf and hard of hearing in the absence of another developmental explanation for that. In terms of difficulties with transitions, difficulties with transitions can reflect difficulty understanding what's happening for the child. And so if there is a mismatch between the child and their communicative environment, that is not enough about what's about to happen is being communicated to the child, you might see that child have difficulty with transitions or until they have the language to understand what is happening in their environment. So typically for children who are just deaf and hard of hearing who don't have autism, if you intervene to teach them either visually what's about to happen or by increasing their access to communication in their environment, you would see that difficulty with transition subside and dissipate. The difficulties with transition that children with autism often have are also sometimes related to just being fixated on what it is that they were engaged with or having a compulsive need to complete what they were previously working on before transitioning. Similarly, one of the restricted or repetitive patterns of behavior that you might see is excessive adherence to routines. We talked before that this could look like a verbal ritual, something that the child insists that you sign or say always the same way every time in that particular circumstance. It can also be an excessive resistance to change. So not liking to drive a different way to school, getting upset if something happens out of order in their schedule, children who melt down when there's a substitute teacher in the class. These are all common ways that this might manifest for children with an autism spectrum disorder. Again, for children who are typically developing, who are deaf and hard of hearing, as long as we provide communication access for their understanding about those changes in their routine, you'll generally see less resistance. Some children who have autism also get excessively and intensely focused on either an unusual interest or one that might be usual but seems unusual for the child's developmental age. So an example of that might be a tendency, again, for a child to get preoccupied with a particular part of an object. Sometimes you'll see children also who fixate on using other senses to explore objects in unusual ways, who might have what we call close visual inspection of toys, where they might get down and look at the wheels of the train engines as they roll them towards them, or they might hold things up and look at them in unusual ways. Again, in the absence of an additional vision difference, we wouldn't expect this in typically developing children who are deaf and hard of hearing. Though sometimes this looks like an intense interest in a particular object or topic. So kids who get very fixated and interested on Thomas the Tank Engine or Pokemon or Transformers or whatever it may be. And what sets us apart as being different than typical development is that the preoccupation is intense and it interferes. So it might be that they're interested in that topic to the exclusion of playing with other types of toys, or that when they're fixated on that topic, or that object, it's not social in nature. That is, they're not allowing other people to enter that play or that interest. It could also be that they have difficulty transitioning away from that to a marked degree that causes significant upset. For children who are typically developing, who are deaf and hard of hearing, you might see that they talk about specific interests that are within their access to communication, that is, that they have the vocabulary around, but you won't typically see the intensity around that or the upset around it when it's removed. It's more about, this is what I'm able to communicate to you, and so that's what it has a social function of that behavior. This is an important point in general in considering the symptoms. The same symptom, the same behavior, may be part of typical development for one child, but might be considered a symptom of autism for another child. And what sets those apart is often whether it's consistent with what we would expect for where they are developmentally and what the function of that behavior is. So a child who is consistently trying to communicate with you by bringing you a particular toy, that could be a very functional and social skill for that child who has a limited repertoire of vocabulary in their communication modality. But for another child who has broader language skills than that and more ability than that, that could look like a symptom of autism if they have skills to be able to communicate about other things but are choosing to only consistently communicate about that one topic. One of the newer changes in the DSM-5 criteria is this idea of children who are either underreactive or overreactive, hyper or hyporeactive to sensory input, or who have unusual sensory interests in their environment. So we've already talked a little bit about that idea of visual inspection, but unusual sensory interests can also look like smelling objects that you wouldn't typically smell, so the child who has to smell everything before they engage with it. It could also look like a fascination with other visual aspects, watching the blinds go up and down or the TV credits rolling down repeatedly. Or children who have tactile interest, who might press their chins against you, or who might seek a lot of tactile input. Sometimes in children who have autism, we see that they are the reverse, that they're undersensitive, so that they don't react in situations where you would typically expect them to indicate to you that they were experiencing pain or heat or cold. For children who are typically developing, who are deaf and hard of hearing, we sometimes do see sensory differences compared to a hearing population. There's limited research about this, but what that literature does suggest is that there are difficulties that might be more commonly seen among children who are deaf and hard of hearing, such as differences with vestibular processing. So those are related to balance and movement. But you're less likely, in the absence of a vision impairment or a visual difference, to see visual inspection or that persistent olfactory or tactile exploration of objects in unusual ways. One of the other ways that we might see these symptoms present in children who are deaf and hard of hearing who have autism is sensitivity to wearing their assistive technology. So children who are resistant to wearing their hearing aids or cochlear implants, beyond what we see at the developmental age, where it's common for children to take off their hearing aids or their implants immediately when they're toddlers. But children who are excessively resistant to those types of interventions around that. And of course, in those situations, you would have consultation with their audiologist. But we also need to be sensitive to the fact that their resistance to it might be part of a symptom associated with these sensory differences for children with autism. And then we would intervene differently, knowing that the child might have an autism spectrum disorder.
Title: Presentation continued at Assessment of Autism Spectrum Disorder with Children Who Are Deaf, Hard of Hearing, Part 3, Deborah Mood, PhD, Colorado School for the Deaf and the Blind. A production of Outreach Programs, Colorado School for the Deaf and the Blind, 33 North Institute Street, Colorado Springs, Colorado 80903. Telephone 719-578-2100. www.csdb.org. Graphic, the CSDB logo.